ভিডিওটি জুনিয়র হোমিওপ্যাথিক চিকিৎসক বন্ধুদের দেখানোর জন্য এবং শেখানোর জন্য। This gentle lady, aged about 64 years. This gentle lady, aged about 64 years, has been suffering from hemolytic anemia. Hemolytic anemia. The anemia developed severely, now a little bit improved. What medicine I had prescribed and what will be the second prescription, I want to demonstrate, my friends. First of all, you know that what is anemia and what are the kinds or types of anemia. Anemia, you know, the reductions of the red blood corpuscles, either in quality or quantity, etc. The types are generally three types. Anemia due to loss of blood, all of you know that. Due to loss of blood, due to hemolysis of RBC, due to hemolysis of RBC, and due to decreased abnormal red cells, abnormal blood cells, decreased the formation of red cells. All are written in the practice of medicine textbook. So this case is hemolysis. Normally, you know, the RBC formation from the bone marrow, এবং আরবিসি 120 দিনের মতন বাঁচে, তারপরে সেটা ব্রেকডাউন হয়ে লিভারের মধ্যে দিয়ে সিনথেসাইজড হয়ে আবার ব্লাডে চলে আসে অ্যাজ এ হিম, নট অ্যাজ এ সেল. তো this is called lysis of the RBC. So hemolysis আর এক্সেস অ্যামাউন্ট অফ যদি সেই হিম বা বিলিরুবিন ব্লাডে ঘুরতে থাকে, তাহলে হেমোলাইটিক জন্ডিস হয়ে যায়. This gentle lady is suffering from hemolytic anemia due to destructive condition of the liver. লিভার সেল, প্যারেনকাইমাল সেল নষ্ট হয়ে গেছে, খারাপ হয়ে গেছে, যার জন্যে হেমোলাইসিস হচ্ছে. সিমটোমেটিক্যালি I had prescribed arsenic alba due to mental restlessness, food caused nausea, tremendous weakness, and the patient is improved a lot. Patient is improved a lot. Now the weakness has gone. She can walk steadily. Now this is the time of the high time for second prescription. What will be the second prescription? Shall I continue the arsenic alba, or I shall switch over for another medicine? I have repeatedly told my friends that it is better to prescribe a first prescription very easily and confidently, but the second prescription is very critical, rational and judicial. এই জুডিশিয়াল এবং র্যাশনালি না করার জন্যে অনেকে কেস ব্লান্ডার করে. Now the patient has developed gastrointestinal disorders and dyspepsia, which aggravates in the afternoon. The patient categorically mentioning the time 4 p.m. and onwards aggravation, desire for sweets and warm food, constipation, and some other symptoms led me to prescribe now the deep-acting medicine Lycopodium clavatum. Why I had prescribed arsenic alba? Because at that time the acute condition was for arsenic alba. The patient was not like listless like this time. She was restless, anxious, and worried. The acute phase is now covered. And though constitutionally Lycopodium was indicated, But it is better to not prescribe lycopodium at the first visit in the chronic case. If you go through the relations of the Allen's keynote, may I remind you the lines from the Allen's keynote? It is rarely advisable to begin the treatment of a chronic disease with lycopodium unless it is clearly indicated. It is better to give first another antibiotic because lycopodium is a deep-seated, long-acting remedy and should rarely be repeated after improvement begins. So it is better to prescribe by any acute medicines for the first time if lycopodium is well indicated. Not always, generally. So this is the second time to prescribe lycopodium. The mental acute phase has overcome and the patient herself is telling that her symptoms are lycopodium. গ্যাস অম্বল পেটের অসুবিধাটা কোন সময় বেশি বাড়ে? বিকালে কটা নাগাদ মোটামুটি ঘড়ির টাইম দেখেন? তিনটে সাড়ে তিনটে চারটের দিকে বাড়ে। So specific modality has mentioned by the patient. What the mental symptoms given importance by Kent, specific modalities given importance by Dr. Cyrus Maxwell Bogart. Because modalities, especially the time modalities, are more specific, more accurate, and more authentic, more reliable, and more stringent. That's why modalities are very, very important, especially time modalities. We have seen the modalities of 7am aggravation, podophyllum, Eupatorium perfoleatum, 7 to 9am aggravation, Eupatorium perfoleatum, 9am aggravation, chamomilla, 10am aggravation, natrum murans sulfur, 11am aggravation, sulfur, 12 noon aggravation, zincum metallicum, 12 to 2am and pm aggravation, arsenic alba, 2am aggravation, 3 pm aggravation, Apis belladonna thuja, 4 to 8 pm aggravation, Lycopodium helleborus colossus, 9 pm aggravation, Bryony alba, 11 pm aggravation, Cactus grandiflorus. So like this, 12 to 2 am aggravation, arsenic alba, 2 to 4 am aggravation, calicarp, 3 am aggravation, ammoncarp calicarp. So modalities of time are very specific and more accurate by friends. Please be remember, time modalities are more specific, more reliable, and more authentic even than mental symptoms.